Sounds good.
Okay. Thank you everyone for joining and welcome to Health at 75. Today's dialogue is part of an engaging series of dialogues hosted by the UN Resident Coordinator Office in the UAE to mark the UN 75th anniversary. And this includes sparking conversations on priorities for the future and obstacles in achieving them. These dialogues provide us an opportunity to reflect and rethink discussions that engage all people on how to navigate the gap between the future, where we are now, and where we are headed. Before we start the session today, allow me to first introduce our guest speakers. UN Resident Coordinator for the United Arab Emirates, Dr. Dina Asaf, and Dr. Hussein Al-Rand, Assistant Undersecretary of Health Centers, Clinic Sector and Public Health from the Ministry of Health and Prevention in the UAE. Dr. Rayana Bouhakka, the Manager, Country Focused Support from the World Health Organization, Eastern Mediterranean Regional Office, and Dr. Shibl Sahbani, Regional Reproductive Health Advisor at the UNFPA Arab States. Thank you all for joining. And to introduce myself, I'm Sarah Shatila. I'm representing Embassy Group's Corporate Sustainability and Social Impact. I'm also a young leader and SDG advocate in the Gender Innovation Agora with UN Women, and I will be moderating the session today. Before we begin the panel discussion, I will leave the floor to Dr. Dina Asaf to provide us with her opening remarks. Thank you.
Thank you very much, Sarah, and welcome everyone to today's UN UAE dialogue. And on behalf of the entire United Nations family in the UAE, I'm pleased that you're joining us today to discuss a topic that we all have had at the forefront of our lives this past year, which is health. And I would like to thank His Excellency Hussein Al-Rand, Assistant Undersecretary for Health Centers and Clinics and Public Health at the UAE's Ministry of Health and Prevention, for his participation and to acknowledge also his leadership and guidance in the UAE's determined efforts in response to the COVID-19 crisis. Today's dialogue is a continuation of a dialogue series we held last year in commemoration of the 75th anniversary of the UN, where we brought together different actors from the public and private sector, civil society, and academia to consult on the priorities of our times and to highlight the importance of interdisciplinary and multi-sectoral dialogues. And therefore, today's dialogue is a continuation, as I've indicated, and also launches this series for 2021, as we'll continue to have these dialogues with you over this year. So monitor our social media for announcements of other dialogues to come throughout this year. And it is in this spirit of exchange and reflection that we as the United Nations in the UAE will continue to host these conversations and to rethink and engage on how to navigate the gap between the future we need and where we are headed. And as we all know, there are gaps that need to be addressed. We therefore appreciate the excellent collaboration between the government of the UAE through the Ministry of Health and Prevention, the World Health Organization Office for the Eastern Mediterranean, and the United Nations Population Fund Office for the Arab States for making this dialogue happen today. With today's conversation, we will benefit from the expertise of our panel members that have key roles in supporting knowledge-sharing platforms and contributing to evidence-based decision-making on the priority policies and programs around health and well-being. As we continue to live through this pandemic, it is necessary we reflect on the lessons learned from now. As the UN Secretary General remarked last month while addressing his priorities for 2021, he indicated that now is the time to secure the well-being of people, economies, societies, and the planet. It is possible, so we must make it happen together. And therefore, I invite you to embrace our interconnectedness as humanity to ensure a strengthened global community. And I look forward to your discussions today to follow in a fruitful way and to help us reflect on how best to work towards a more equal and sustainable world. Stay safe and be healthy. Thank you very much.
Thank you, Dr. Dina, and thank you for making these dialogues and engaging everyone. They have been very fruitful. Before I introduce Dr. Hussein, if we can all just take a moment and reflect on how our daily routine has been in a world before COVID-19. And I think it's very hard for us to imagine and see how it has impacted our day-to-day lives. And we are living now what we call the new normal. But at the same time, it has also revealed underlying structural inequalities in our societies. And health now more than ever has become a global focus and concern. It is also essential for the development of the 2030 Agenda for the Sustainable Development Goals. Today's session, Health at 75, will highlight some of the lessons learned, the achievements and challenges, and we will discuss with our speakers and talk about priorities for the future and the role of country-level and international cooperation in making such progress, with a particular focus on the Sustainable Development Goal number 3, good health and well-being. And to get a closer lens on the context of the UAE, we are pleased to have with us today Dr. Hussein Al-Rand, the Assistant Undersecretary of Health Centers and Clinic Sector, Ministry of Health and Prevention and Public Health in the UAE. I'd like just to note that Dr. Hussein will provide his remarks in Arabic, and for all those who are non-Arabic speakers, I will be providing some highlights on his remarks in English afterwards. حسين أهلا وسهلا فيك وتشرفنا بحضورك معنا. بدنا نعرفك بالعربي، طبعا هو غني عن التعريف، وهو وكيل وزارة الصحة والمساعد لقطاع المراكز والعيادات الصحية والصحة العامة. دكتور حسين.
السلام عليكم ورحمة الله وبركاته. مساء الخير، يسعدني بداية أن أكون معكم. أصحاب السعادة أيها السيدات والسادة، يسعدني أن أتواجد معكم في الندوة الافتراضية للذكرى ال75 للأمم المتحدة، وتطلع لمناقشة دور الصحة وأهميتها للأمم المتحدة. تعتبر الصحة واحدة من أهم ركائز وأولويات المنظومة منذ إنشائها، وذلك عن طريق تعزيزها وحمايتها في جميع أنحاء العالم. وتقود منظمة الصحة العالمية هذه الجهود ضمن منظومة الأمم المتحدة، والتي دخل دستورها والذي حيز التنفيذ في 7 أبريل 1948، وهو التاريخ الذي نحتفل به كل عام بيوم الصحة العالمي. وبهذه المناسبة أود أن أشيد بدور منظومة الأمم المتحدة في تعزيز تغطية تدخلات منظمة الصحة العالمية في مختلف مجالات الرعاية الصحية على النطاق العالمي، بما في ذلك التدخل في حالة الأزمات والاستجابة لحالة الطوارئ الإنسانية، واعتماد اللوائح الصحية الدولية، والوقاية من الأمراض غير المعدية، والتغطية الصحية الشاملة، وغيرها من التحديات الصحية العالمية. ونتيجة للجهود المبذولة فقد تحسن الوضع الصحي لشعوب العالم، لكي يبقى هناك تفاوت بين الدول وفي كل دولة بذاتها. وعلى الرغم من تلك الإنجازات، جاءت جائحة كوفيد-19 لتهدد هذه الإنجازات وتذكر العالم بأننا غير مستعدين تماما للتصدي لها، وأننا بحاجة لتعزيز النظم الصحية بمعايير جديدة، وبحاجة للتعاون والتضامن العالمي بين الدول الأكثر من أي وقت مضى. وستحدد استجابتنا والتزامنا بهذا التوجه مدى سرعة تعافي العالم واستعداده للجائحات القادمة. فهل نحن مستعدون للجائحة القادمة؟ أيها السيدات والسادة، عملت منظومة الأمم المتحدة على تجديد أهداف التنمية المستدامة عام 2015 ذات الرؤية الواضحة من أجل القضاء على الفقر وحماية كوكب الأرض وضمان تمتع جميع الشعوب بالسلام والازدهار بحلول عام 2030. ويعتبر محور الصحة هو حجر الأساس في جدول أعمال التنمية، والمرتبط بالهدف الثالث تحت عنوان الصحة الجيدة والرفاهية. ومن الجدير بالذكر أن أهداف التنمية المستدامة الأخرى تؤثر بشكل مباشر أو غير مباشر على الصحة. ومكوبة الأهداف التنمية المستدامة فقد حرصت دولة الإمارات العربية المتحدة بقيادة صاحب السمو الشيخ محمد بن راشد آل مكتوم بتدشين مؤشر الأجندة الوطنية للدولة 2021 لتتوافق مع أهداف الهدف الثالث للأجندة العالمية 2030 باعتبار الصحة واحدة من الأولويات الوطنية الست لرؤية الإمارات، ومن أجل الوصول إلى أعلى درجة من الكفاءة في تحقيق أهداف التنمية المستدامة، تبنت دولة الإمارات العربية المتحدة نهجاً حكومياً شاملاً انبثقت عنه لجنة وطنية معنية بأهداف التنمية المستدامة، والتي تضم جهات حكومية اتحادية ومحلية، وتعمل هذه اللجنة على موائمة أهداف التنمية المستدامة ومشاركة المعلومات وتقديم الدعم في تنفيذ أهداف التنمية المستدامة. كما تتعاون اللجنة مع مختلف أصحاب العلاقة المعنيين محلياً ودولياً لتوسيع نطاق الشراكة في تنفيذ أجندة 2030. وتسعى وزارة الصحة ووقاية المجتمع لتعزيز صحة المجتمع من خلال توفير خدمات الرعاية الصحية المبتكرة والعادلة وفقاً للمعايير الدولية. كما تعمل الوزارة كجهة تنظيمية للقطاع الصحي بالدولة من خلال نطاق تشريعي صحي متكامل. كما تطمح الدولة إلى إنشاء أحد أفضل أنظمة الرعاية الصحية في العالم بحلول اليوبيل الذهبي لتأسيس دولة الإمارات العربية المتحدة. أيها السيدات والسادة، إن دولة الإمارات العربية المتحدة تولي أهمية كبرى لتحقيق سعادة الأفراد والمجتمع، وتعتبر ذلك من أولوياتها، وتحرص على توفير الرخاء والرفاهية والاستقرار لشعبها والمقيمين على أرضها. والوصول إلى هذه الغاية فقد أطلق صاحب السمو الشيخ محمد بن راشد آل مكتوم نائب رئيس الدولة رئيس مجلس الوزراء حاكم دبي حفظه الله في عام 2019 الاستراتيجية الوطنية لجودة الحياة 2031 بهدف الانتقال بدولة الإمارات العربية المتحدة من مفهوم الحياة الجيدة إلى المفهوم الشامل لجودة الحياة المتكامل. ومحور الصحة وأنماط الحياة الصحية النفسية هي من المحاور الرئيسية لهذه الاستراتيجية. كما أعلنت دولة الإمارات العربية المتحدة أن عام 2020 هو عام الاستعداد لل50، حيث تتطلع القيادة الرشيدة إلى أن تكون دولة الإمارات العربية المتحدة خلال ال50 عام المقبلة الدولة الأكثر تميزاً والأفضل في جودة الحياة على مستوى العالم بما في ذلك الصحة. وسيتم هذا من خلال مواصلة مسيرة التنمية عبر حشد الجهود المؤسسية في الدولة وجميع الموارد والإمكانيات ضمن مختلف الكوادر القيادية والإدارية، بالإضافة إلى الاستثمار في الخبرات والعقول الإبداعية والمواهب والكفاءات الاستثنائية لتصميم منظومة جديدة لل50 عام المقبلة نحو مستقبل مستدام للدولة. وختاماً أود أن أقول بأن توحيد الجهود وتبادل الخبرات والاستفادة من جميع الإدارات والقدرات المتاحة وتسخير المعرفة والتكنولوجيا والذكاء الاصطناعي من شأنه أن يسهم في رفع مستوى الحياة والمعيشة. والسلام عليكم ورحمة الله وبركاته.
شكرا لك دكتور حسين. يعني فعلا طبعا الامارات هي دائما سباقه بكل الجهود وخصوصا بقطاع الصحه. رح جرب I will try to use highlights on Dr. Hussain's notes in English. I'll try to give it justice. Of course, the UAE has always been a great supporter and a partner with the World Health Organization, joining efforts on their mandate and particularly celebrating on the World Health Day since it first started in 1948. And within the global intervention and emergency response that we have witnessed throughout this year, we noticed how unprepared we are for the next global pandemic. And this is why the question remains, what can we do and how can we prepare ourselves? And the UAE has been working throughout the years on collecting efforts, on making sure that working on all levels of cross stakeholders within the government and also with partners to make sure that they provide the best quality healthcare services and equal healthcare services and access to everyone. In 2019, there has been a national strategy put in place on the Quality of Life Index, and the health and well-being has been one of the major pillars and as a key focus. And within the next 50 years, the UAE aims on becoming one of the top leaders and pioneers in providing top quality living standards and particularly with health and well-being, and providing and setting the structure and infrastructure and resources, working with leadership, management, talents, and everyone across to really build a strong foundation and an entity where we can all work together to overcome and also achieve the goals of 2030. That's good?
That's good, yes. And as you said, we should utilize the technology as well as artificial intelligence, which will share in keeping the health well-being.
Absolutely, of course. Now, before we begin our panel discussion, I would like to invite you all to start sharing your questions in the Q&A box, and we will make sure to go over them with our guest speakers. So up next, we have Dr. Rayana Bouhaka, Manager and Country Focus from the World Health Organization. Dr. Rayana is a medical doctor specialized in pediatrics. Okay, with Master in Public Health. She has years of experience in clinical public health and policy work. She joined World Health Organization more than 20 years ago, working in emergency programs and taking on developmental and strategic roles at the regional and country level as part of the Regional Director Office. She's currently also managing the UAE's program from the regional office. And Dr. Shabl Sahbani, who is the UNFPA Arab States Regional Reproductive Health Advisor. He's a medical doctor specialized in emergency medicine, holds a master's in development studies, global health, and population issues from several universities. He has been working with UNFPA for the past 11 years in humanitarian health and managerial roles in many countries across the region, including Jordan, Tunisia, Libya, Syria, Morocco, and Egypt. Before joining the UN system, he worked as a practitioner in the Moroccan Ministry of Health and with private sector and NGOs managing public health and humanitarian assistance portfolios. In his current role within the UNFPA, he provides health technical assistance and policy advocacy to Arab countries, including UAE, through regional office and GCC office. Thank you both for joining us. Dr. Rayana, I would like to start this panel discussion by addressing the question to you. As a country-focused support manager, what were some of the major lessons learned, or still being learned in fact, from UAE's response and reporting on COVID-19? What are some of the key priorities for future preventive measures you would think in order for the world to be more prepared and equipped for the next pandemic?
Thank you very much, Sarah, and very pleased to be with you. I have to mention that as part of my work in support of the UAE, can I just 1 second try to turn off this call? Do you hear it? No. Okay, so it's fine. As part of my work, I do apply all the measures and all the at least policies that we have in collaboration with any country, but more specifically with UAE, it's a much refined kind of work. So from the lessons learned, as we have seen, all the countries have been affected, all the countries were not adequately prepared. However, from the lessons learned, we see that first, at the level of the leadership and the governance, UAE has shown a great commitment to ensure that the health of the people comes first. And whether these people are national citizens or even people living in UAE, passing by in UAE. So this was very important at the level of setting up the real high level whole of government and whole of society approach in managing the response and in addressing the urgent needs. It has also looked at making sure that there is ongoing public information and transparent communication, increasing awareness, joining the people in terms of calling like a hotline and responding to the multitude of queries that people had even in the beginning, and it continues now, and also making sure that the adequate plans are reviewed, are flexible and agile, and are updated by science and information. And I think this was important. Many countries have struggled in using the data, and as Dr. Hussein has mentioned, artificial intelligence and trying to also push at least innovation in many ways. So even access to health services by use of telemedicine or by use of calls, appointments, dedicating health facilities for people to continue accessing their regular services, which, as we know, have been all affected by the pandemic. At the same time, the use of data and the generation of data according to the guidance on surveillance and guidance on utilizing the hotspots, mobilizing many ways to have a surveillance and information system informing policies was very important. I would say also the investment. Dr. Hussein mentioned that even before COVID, there is a high price and a high investment on health and on the well-being of people. So this does not come then as a, an after fact or afterthought event. And that is important to really mobilize all the sectors of society to work towards the improving the health of people and protecting the health of people, making sure that in the way also capacities were updated. Even we're all using now virtual meetings, virtual training, but that was also adopted from the beginning. There are many. I can stop here, not to crowd the floor also, but definitely many lessons learned. Over to you, Sarah.
Thank you, Dr. Rayana. It's very helpful. And I'm sure, a lot of the audience would like to know more, and maybe, we can wait until further questions as well. Dr. Shibl, we talked about the Sustainable Development Goals and how important it is to really work together and to have all stakeholders working towards, achieving the goals. How important and in what ways is the UNFPA collaborating with partners and stakeholders? And especially, with the UN agencies, how are you ensuring synergy across all agencies towards achieving those common goals?
Yeah, thank you very much, Sarah. First of all, let me thank you personally and also all our distinguished speakers and audience. I think this is a very important webinar that we have today in celebration of the UN at 75, but also in celebrating health in general, which is really one of the pillars of the 2030 agenda. Of course, as you rightly said, each UN agency has a specific mandate and a particular comparative advantage. But first, let me give you an overview about the United Nations Population Fund, also for our audience. So UNFPA is the United Nations Reproductive Health Agency. Our mission is to deliver a world where every pregnancy is wanted, every childbirth is safe, and every young person's potential is fulfilled. We provide reproductive health care for women and youth in more than 150 countries, which are home to more than 80% of the world population actually. Now, in addition to working directly on health and particularly on reproductive health in both development and humanitarian settings, we work also on three other main pillars. The first one is gender equality and combating gender-based violence. Also, we work on youth, and we work on the third one, which is population dynamics and data. Now, to respond to your question, our goals by 2030, or what we call the transformative results, are three. The first one is the reduction or zero preventable maternal death. The second one is zero unmet need for family planning. And the third one is zero gender-based violence and harmful practices. But to be able to do that, we cannot do it alone, of course. We are within a UN system and we work also with the partners. And each agency has a comparative advantage and has a specific mandate. But we complement each other. How we do that? First, we have what we call the regional and also global coordination mechanisms. Of course, at the country level, also there is the resident coordinator and the UNCT and the HCT, depending on the development or humanitarian context. But also at the regional level, we have what we call the issue-based coalitions, where we have the different stakeholders and each one can contribute with each portfolio depending on its own resources, depending on its expertise and comparative advantage. We have other models like the Regional Gap Alliance on Health. We have the Global Interagency Working Group on the Reproductive Health, which is one of the main coordination mechanisms that include different UN agencies and beyond the UN system even. We have the H6 partnership for maternal and child health, which includes UNFPA, WHO, UNICEF, World Bank, UNAIDS, and UN Women. And recently, we also created what we call AWAN, which is the Arab World Advocacy Network for Reproductive Health, where we have the different stakeholders meeting together to do advocacy, to complement each other's work, and also to discuss what are the challenges and what are the opportunities to advance the health agenda in general, and specifically reproductive health. We work also through the partnership. So here, I think that the main idea is that the UN system should deliver as one, and this is what we are doing. But of course, we cannot do it alone. We work with our partners for better effectiveness and also better efficiency.
Thank you, and definitely, even partnerships is one of the main goals of the SDGs 2030. It's SDG number 17, partnership for the goals, and I think the UN, represents by working together and forming those cooperations and inviting all stakeholders to be part, we can achieve those goals faster and quicker. Let me just add one question, or from the audience. Mahmoud is asking about if you can just mention to us the SDG targets linked to SDG number 3. That will be helpful. Thank you.
Thank you very much. There are several targets under the SDG 3, and I see the question also is how do they link with all the other SDGs? And in fact, the whole Agenda 2030, along with the targets and the goals, show the interconnectedness and the interdependence of each. Now, under SDG 3, we have mainly the attainment of universal health coverage, UHC, التغطية الصحية الشاملة. And in that, there are several goals underneath it, targets underneath it, whereby we will have to, first, of course, linking it to other SDGs, leaving no one behind. So everybody, all the people covered with an essential package of health services, at least covering all their needs from preconception to conception to as Dr. Shibel has mentioned, the period of pregnancy, delivery, and then adolescence as the child is growing and becoming an adult, and also moving into the age where we see more non-communicable diseases threatening the lives of people, and also towards aging and all the needs in that perspective. So it's the coverage along the life course, and it's making sure that this coverage is including curative, promotive, and also preventive, including vaccination, which we all know are as essential as all the other services. Under also the SDG 3, we have the investment in health and the financing of health care in a sustainable way. And it's not only the services, but also looking at the determinants of health and working then with other sectors and with other goals on education, on employment, on gender, on peace. The most importantly, in our region, we have more than 50% of our countries in conflict or facing crisis. And I think this is where it's important to link up to other SDGs. Under the SDG 3 also, we have the unfinished agenda from the MDGs. So of course, addressing child maternal mortality and maternal health and childhood health, but also mental health, which is an important area, as mentioned by Dr. Hussein and by colleagues, and also the importance of addressing the killers, let's say the unfinished business from TB, HIV, malaria, but also non-communicable diseases, which are now causing more than 70% of the death everywhere. And under non-communicable disease, I mentioned specifically cardiovascular diabetes, hypertension, but also we include a lot of the mental health conditions, which sometimes are not always well covered. We look also at road safety. We look at environmental health and anything linked up to also then underwater and under the climate, under the forests, and most importantly, the link now with the COVID, with what causes those zoonotic diseases and the viruses that jump from the animal world to the human and affect humans. And this we work also with other partners like FAO and OIE who deal with animal health. And we work together with countries in support of all their efforts and interventions. And as you know, I didn't mention maybe, but WHO works on several levels. We work on the guidance, providing the standards, providing the information and the know-how, but also providing the technical support and helping implement as much as possible where is needed those policies and guidelines. There are, of course, definitely other connections to many of the other SDGs, but I will stop here as we want to give also space for other issues to be discussed. Over to you, Sarah.
Thank you so much, Dr. Rayana. And speaking of public health policies and actions required, Dr. Shibli, given your experience working in multiple Arab states, how can the demographic population and social inequalities and the conflicts that Dr. Rayana mentioned as well limit healthcare access? And what are some policies and actions that are required to achieve health at 75?
Thank you for this very, very important question. Actually, it's very crucial. As you rightly said, there are big inequalities between the countries and even within the countries themselves. These inequalities in general may be related to geography, to wealth, to level of education, gender inequalities. I know that you are a gender equality advocate, but also they can be linked to social and legal status of beneficiaries. For instance, adolescent girls and unmarried women don't have the same access to family planning, for instance, in many countries. Also, depending on the legal status. For instance, migrants, refugees, asylum seekers, and my colleagues, they mentioned the humanitarian situation prevailing in our region. Those migrants, refugees, asylum seekers, and so on, they don't have the same access to the services, or sometimes with less quality of services. So this creates big disparities between different categories of the population. But it's very obvious that this has a big impact on the health outcomes. And let me give you a concrete example. Here in our region, fortunately, we host the country with the lowest maternal mortality ratio in the world, which is 4 maternal deaths per 100,000 live births. But at the same time, we host a country with one of the highest maternal mortality ratios in the world. This shows the big disparities in different countries in this region. But also within the same region, even with the big progress that we made since the MDGs era, the disparities has even deepened. In certain countries, the difference between the first quintile and the fifth quintile has even worsened. But I think today there is a policy movement towards eliminating inequalities in health as one of the core development goals. And this movement ensured on three main pillars of current development thinking. The first one is the 2030 agenda, with its motto, leaving no one behind. So this is the first one. The second one is the very ambitious program of action of the ICPD. You know that in 2019, we celebrated 25 years after the International Conference on Population and Development. And in Nairobi Summit, the different stakeholders, governments, academia, NGOs, international NGOs, donors, activists, and so on, they renewed their commitments. And one of this commitment was to ensure health to everyone, universal health coverage, and this cannot be done without universal access to sexual and reproductive health and ensuring reproductive rights. The third one is the WHO social determinants of health resolutions that call for health in all policies. And now, fortunately, we are witnessing a big movement trying to address health in different policies. And this takes me to what should be done. So let me address it from sectoral point of view. First, the role of the health sector. The role of the health sector should be done in, let me frame it around the three pillars of the universal health coverage. First is to make sure that we have a wide coverage of services. So this is the first one. The second thing is to ensure a good financial protection and to make sure that all, the citizens and the population in the country in general, they have a good health insurance and they are well covered. And the third one is to ensure that we have a full package of essential services delivered to everyone and everywhere. So this is the role of the health sector. But of course, the health sector cannot do this alone. We should involve the other sectors, social sectors, and to make them accountable, they have to realize that they have a role and they are a key stakeholder in health, but also to make them accountable. And here I give a concrete example when it comes to maternal health. Again, we have the 3 delays model when we talk about the maternal death. And we know that the first delay is due to the time needed to take the decision to go to the health facility. And what has an impact on this is the ability of women to take the decision. The second is, do they have the financial resources to go to seek health services? So this is beyond the health sector. Other sectors should be involved in this. The second delay is about transportation and the delay to reach the health facility. This is also beyond the health sector. And of course, the third delay, which is inside the health facilities, that can be addressed by the health sector. Another sector is the academia and the think tanks. And they have a strong role in terms of generating knowledge, research, and so on. But also, it's not only about understanding the inequalities or identifying the inequalities, but also to make recommendations how to address these inequalities. There is also the role of the what we call non-governmental or non-state actors. And here I'm talking about NGOs, CSOs, and so on. They have a role in terms of advocacy, but also they have a role in demonstrating the effectiveness of these policies and their impact through pilot community interventions. I will conclude with some enablers, which are really, really important. The first one is data and data again. Dr. Rayana mentioned that, Dr. Rand mentioned that. It's very important to strengthen the health information system to be able to identify, monitor the inequalities. And also sometimes, like the MDSR, to link these inequalities with their root causes. The second one is research. and analytical capacities of the decision makers, policy makers, and so on, and also to establish a policy dialogue. And the third and last one is to allocate resources. Of course, we can have policies, strategies, and so on, but without allocating resources, and here I'm talking about financial resources, but also human resources. And here I'm happy to announce that now WHO and UNFPA are working with different ministries of health under the chapeau of the League of Arab States to develop the first ever health-friendly budgeting strategy that will be endorsed hopefully next year in the Arab Ministers of Health Council. Thank you.
Thank you, Dr. Shebel, for these rich insights. I think it really puts the issue in perspective. And Dr. Ayala, talking about maternal, child, and adolescent health, how has the global pandemic in particular affected those different parts of society across the region, and especially in those within the maternal health? And in what ways would you think the empowerment of women can actually help support their specific health needs and address them?
Thank you very much. It's very important to focus on that and to highlight the multiple impacts. There are, of course, direct health impact on the health of women and children, because this is a disease that is easily transmissible, and it can infect anyone. So whether it is at work or whether at school or at the house itself, everybody is exposed and affected. But women are definitely more affected, and because they are the carers at home. Women will care for their parents, but for their husband, for their children, and for also sometimes even the neighbors. Beside the direct impact, working women have faced a lot of difficulties, because especially, and I want here to salute all the healthcare professionals, men and women together, but especially the women, because they do carry a lot of the burden of going to work, supporting the care that is needed for people affected and so on, being exposed, and also fearing for their families and transmitting in many times the disease. So working women have been faced with a double burden of making sure that they do care of everybody who is under lockdown at home, but also with the work, whether it is still working or going to work in this respect. Many have not been able to maintain their health checks. If they are pregnant, they need to go to antenatal care services and to check whether, a simple worry is something that is more serious or not. So we have seen people even delivering preferably at home rather than going to hospitals because of being afraid of getting exposed to the disease. And this, as Dr. Shebel has presented before, with the delays and with the lack of sometimes trained and capable people attending the delivery, then we are putting the mother and the baby at risk and higher risk. They have not been able to take their kids and go to get the vaccines. Many have not been able to follow their checkups, whether if they have diabetes happen or other conditions. And also they have been managing at home the potential and the high risk of violence because of the stress that everybody is feeling. Beside the people that are under lockdown, teaching kids remotely is not easy, making sure that they do follow that, trying to cook and prepare and without any physical activity because they are not going out, so being afraid also to gain weight, but also dealing with the frustrated youth or frustrated husband or even frustrated themselves, is a lot. So we have seen a lot of impact on mental health. And with the uncertainty about how to go forward, I think it's mothers who bear the burden. It is important that we support them And we make sure that we have means and ways to, if we can deliver the service as close as possible. There are, I know, a lot of new innovative ways of delivering the medicines, making sure that there are calls and follow-up checks on the phone with telemedicine or with calls. But also there is important that we have people to listen, or people to talk to, people to, you know, to maintain that human connection, and that also reassuring stop, at least, you know, call to be there. Somebody to listen is important. We are afraid of the also baby boom. We access to contraceptive, and I know that Shibel is very much concerned about it, is definitely, you know, under lockdown will be completely affected and reduced. Besides that, there are also supply chain problems, you know, so in some countries, you know, to even deliver those and to find them in nearby pharmacies or etc. had been difficult in some periods. So the choice become difficult, and also we know that with and we are monitoring the impact on the pregnancies and deliveries, and that is also important to take into consideration. We also now mobilize and try to attract and also make them more aware on the issues of vaccines, especially with now the available vaccines that hopefully once rolled out will also reduce transmission and reduce the people being at risk to catch the disease. Mothers have always taken their children to the health facility to take the vaccines, and I think they are our allies at home. I stop here and over to you, Sarah. Thanks.
Thank you. So we're really looking at health consequences that are even beyond this pandemic, and you know, it's very important that we're talking, and that, you know, you guys are starting to take action in preparation and trying to avoid more, you know, consequences and effects. But one thing you mentioned particularly about mental health, and we have one of the questions from the audience asking if we can mention some initiatives that we're taking in the UAE to support mental health. And do you think mental health should be a strategic criteria or an indicator of wellness and well-being in the UAE? So I don't know if Dr. Hussein would like to take that question.
Actually, the mental health is one of the strategic points in United Arab Emirates. And recently, the Prime Minister Office have issued the strategic plan for the mental health, as well as during the pandemic, we have given psychological support for both the healthcare workers as well as the patients and the family who faced this pandemic. So this is a short answer regarding his query. And now we have also the mental health service also within the primary health care. We have trained the primary health care physician to be able to give the support from the psychological points as well as the mental health. And in the future will be the mental health, it will be within the school also. Support for the school for mental health also.
Thank you for that.
I just want to complement what Dr. Hussein had said, because we had started even before COVID on the mental health outreach in schools with teachers and with at least trainers who would then bring that training in schools. And also they do play, especially now with the remote teaching and virtual education, a big role in making some sort of normalcy at least be there. We also have worked with other agencies, and it's not only WHO, there's work with UNICEF and with other also agencies on the toolbox and a platform for mental health. Initially, it was designed for mental health, for healthcare professionals, but it also can be used by anybody. And it looks at a self-assessment on the stress level and also bringing in with the cognitive tools, how to deal with the stress and how to manage stress. And I think we've tried to make it, it's available to anybody, and I encourage people to look into it. There are, of course, then degrees where we need more, as Dr. Hussein mentioned, dedicated care specialists, or at least more trained people to address some of the needs. And this is where we have to continue on bringing the capacities as close to people as possible, working with communities and with where we can, in some countries with some NGOs that can support and deliver and help also the national authorities in this. I stop here. Thank you.
Thank you for that, Dr. Shabl. So speaking of UAE's strong emergency response and efforts towards, health and well-being, and in light with UN's mandate, can you highlight some of the complementarities and comparative advantages of the UN's strategic positioning in the UAE and your role in providing health and technical assistance within on a local context?
Yeah, thank you very much, Sarah. Again, another very important question. Okay, so I will focus on humanitarian, but let me first give just like what kind of modes of engagement do we have with countries in general, including the UAE, and then I will highlight the very important role that UAE is playing in terms of humanitarian response. So, of course, as different UN agencies, we engage with our partners at the governmental level at different levels. The first mode of engagement is advocacy. And here I will highlight the role of the UAE in humanitarian. So I was very fortunate to be a part of the team that met in Abu Dhabi in 2015 for the Every Woman, Every Child working group on humanitarian challenges under the high patronage of Her Highness Sheikha Fatma bint Mubarak. And the outcome of that meeting was the Every Woman, Every Child, Everywhere. It was an unprecedented global multi-stakeholder movement to integrate the humanitarian aspect and in the global strategy for women's, children's, and adolescents' health. So this is one of the big examples where advocacy can lead into global and even regional strategies to address different components, including humanitarian in this context. Because the first part of the strategy was focusing on development, 2010, 2015. Then the second part, under the patronage of Her Highness, the humanitarian aspect was integrated for the second part, 2016, 2030. Another example in terms of advocacy, you remember that most of us, we met last week for the second regional forum on cervical cancer from Sharjah. It was done virtually, and it was in partnership between UNFPA and Friends of Cancer Patients of UAE. This is a very good example of a partnership to do advocacy and also to share knowledge and so on. I will move to the second mode of engagement, which is the knowledge management. I think it's very important to document the good practices, and UAE is pioneer in many initiatives. One of them was, again, as we discussed last week, the introduction of the HPV vaccine, and the UAE is the only country who reached now more than 80% of coverage with the HPV vaccine. Also, we worked with the UAE to develop, first to conduct an analysis on the integration of the SRH package into the primary healthcare, and we developed an automated tool. Just to give you a few concrete examples of the outcome of this kind of engagement. Now, let's discuss about service delivery and about humanitarian, which is another mode of engagement. So first, again, I want to highlight the crucial role of UAE is playing in humanitarian response. And I had the chance, again, to work closely with them and mainly with UAE Red Crescent in Tunisia during the Libya crisis in 2011. I worked very closely with them also in Jordan, where they had what we call the Emirati camp near Azraq camp to host the Syrian refugees during the Syria crisis that started in 2012. So I think that the UAE has a very important role, but also the UN system has a very important added value in terms of ensuring that the standards are aligned with the global standards and to integrate certain aspects of gender equality, of leaving no one behind, of addressing inequalities, human rights, and so on and so forth. So this can be done very closely with our partners in the UAE. Another mode of engagement is the partnership and South-South collaboration. And you know that UAE can play a critical role in terms of South-South collaboration. Our colleagues mentioned innovation, and they know that UAE is investing a lot in innovation, not only in terms of new technologies, but also in developing new approaches and new methodologies. And this is really important, and maybe other countries with less resources, human resources and financial resources can benefit from this experience, and the UN system can facilitate such experience sharing and South-South collaboration in the region, but also beyond the region. Over to you, Sarah.
Definitely, thank you so much. And I know our time is coming to an end, but you know the engagement and the discussions are very fruitful and they're very important as well for us to know. If there aren't any more questions from the audience, perhaps we can hear some closing remarks from each of the guest speakers before we close. Dr. Ayana, go ahead. You're on mute.
Yes, as usual. Thank you very much for the questions, Sarah, and thank you, Dr. Hussein and Dr. Shubel. I just want to highlight the importance of, in this period, of solidarity and of science and of making still health as the first worry and at the center of all our work. Science, because we're still learning a lot about this virus and about what works, what doesn't work. And also we need to look at all the data that is coming and all the expertise and experiences from countries and assess them and use that as evidence to improve our support and response. Solidarity, because as we have seen, and it is important that we all work together and we all support each other until this pandemic is over. And as long as there is somewhere in the world where this virus is still transmitting, I don't think we are safe. And lastly, maintaining as the example of UAE, but also for other countries, investment in health, and health is at the core of development and shouldn't be at the expense of anything else. Thank you, and over to you.
Absolutely. Dr. Hussein, تفضل.
At the end of this session, I would like to thank everybody. And I would like to say that health service is available for everyone who is living in UAE, even national or non-national, and UAE will not leave anyone behind. Thank you.
Definitely. Dr. Shubel, تفضل. Go ahead.
Thank you very much. I think what Dr. Rand said is very insightful, and actually it was my main message. Let me first congratulate all of us for this very important webinar, but also to thank our colleagues, Dr. Hussein, Rand, Dr. Rayana, Dr. Dina, and all colleagues, and you, Sarah. And I want to conclude with three main messages and or the things that we need to focus on. The first one was already highlighted by Dr. Hussein Rand, is leaving no one behind. And I think even if we make a lot of progress, we should not forget those left behind, the minorities, the most vulnerable ones, because in general or very often, the national averages, they hide some inequalities and disparities, and we forget that some of our citizens are left behind. The second message is partnership, partnership, partnership. I think اليد الواحدة لا تصفق. This is what we say in Arabic, and I think it's very important that we join our efforts. When I talk about efforts, I talk about expertise, human resources, financial resources, everything, innovation, and so on. So partnership is very important. And the last message or takeaway is generating evidence and generating data and analyzing data and use it for policy advocacy and for decision making. I think this is something that we should invest more and more in it. And thank you very much again.
Thank you so much. Allow me, to feel, very grateful for your time and for being here today, Dr. Rayana, Dr. Shibal, and Dr. Hussein. You all provided very valuable and essential insights, and I think and I hope it sparks the motivation for people to really take action and to start forming collaborations and to work together and making sure that no one is left behind, of course. Thank you to all of our audience as well for your time, and we hope you enjoyed this session. Make sure to engage on social media, follow World Health Organization, follow UNFPA, follow the UN and the UAE to stay informed and to also stay engaged and hopefully attend more of these sessions. Stay safe, stay healthy, and stay informed, and we'll see you soon. Thank you, everyone.
Thank you, colleagues.
Thank you, Sarah. شكرا جزيلا.
السلام عليكم.